Good afternoon, everyone. Thank you for joining us today for a conversation on veteran suicide prevention. My name is Cheree Tham. I'm the co-founder and vice president of programs and initiatives at America's Warrior Partnership. America's Warrior Partnership empowers communities to empower veterans. Our foundational model for community integration is a proactive, solution-focused, warrior-centric model encompassing 4 steps: connect, educate, advocate, collaborate to holistically support warriors. The model is simple but dynamic, so it can adapt to the community and those it serves within the community. Today, our goal is to share with you the best practices and resources available to support prevention efforts around suicide. And I am joined today with Kaitlin Cashwell and Dr. Deb Stone. Kaitlin and Deb, would you please introduce yourself?
Sure. Thank you, Cheree, for having us on the call today. I'm Kaitlin Cashwell, the Director of Community Integration for America's Warrior Partnership, and I've been with the organization since inception in 2013. I've had the luxury of being a part of a CDC evaluation project with the CDC and CDC Foundation for 2 previous years, and I'm excited to talk about just the stuff that we've learned for our program and how we're continuing to refine it to be that upstream approach.
Great, thank you. Deb?
Hi, everyone. I'm Deb Stone. I am the team lead for CDC Suicide Prevention Team. We are a team housed in the Division of Injury Prevention in our National Center for Injury Prevention and Control. The team has been together for just about 2 years now, but I've been working with CDC for suicide prevention for 11 years and have been also working at the state and local level before that. So I'm really happy to be here and join in this important conversation.
Yes, great. We're happy to have you. There are over 40,000 veteran-focused organizations within the United States. The majority of community provider efforts focus on complexity of needs, and there are very few service providers that focus on the circumstances that prevent a downward trajectory. This approach is similar to treating heart disease by waiting for someone to come into the ER with a heart attack. By proactively engaging those who are not seeking access to immediate needs, you can increase protective factors within that individual's life to help prevent them taking their life prematurely. Deb, can you please address why it's so important to have an upstream approach to suicide prevention?
Sure. This is a really important question and is really at the heart of a public health approach to prevention. And before I answer this question, I just wanted to start with a few facts and figures for folks. So first, we know that suicide is a leading cause of death across the lifespan, and rates of suicide have increased 33% between 1999 and 2019. And we know, of course, that veterans are disproportionately impacted by suicide. Second, suicide is a complex problem, and it's not caused by any single factor. So we know from the data that people who die by suicide have typically faced multiple challenges in their lives, things such as relationship problems, social isolation, job or financial problems, health problems, substance misuse, and some are struggling with untreated mental health conditions. And we know that health disparities play a really big role in suicide, and some groups such as veterans and sexual gender minorities and others are at increased risk of suicide. And health disparities related to include things such as disadvantages in education or income, access to healthcare, discrimination, and the like. And so an upstream approach considers or asks the question, how do we address health disparities and the factors that influence suicide so that people don't become suicidal in the first place? Mm-hmm. We'll always support and prioritize and treat people who need it, of course, But wouldn't it be ideal if we could address health disparities and reduce the number of people who struggle with thoughts of suicide and attempts in the first place? Doing this will really help to reduce the number of people struggling and who need treatment and other supports later on in life. So taking an upstream approach is the way we can make a real impact, prevent suicides, improve people's lives, and help reverse some of those long-standing trends.
Yeah, absolutely. And what you're talking about is the upstream approach, that if we wait until a person is completely overwhelmed from some of the factors that you've just listed, then it's too late. And the ensuring that the individual's quality of life from the beginning is going in an upward direction, and that we can get ahead of the crisis.
Absolutely.
Yes, thank you. Kaitlin, can you talk to our viewers about America's Warrior Partnerships model as it relates to community integration and the upstream approach that Deb has just discussed?
Yeah, thank you, Cheree, and thank you, Deb, for setting that stage for us. But the 4-step plan that Cheree talked about, connect, educate, advocate, and collaborate, is that simple approach but dynamic in nature. So connecting with veterans, family members, and caregivers, and then connecting with local partners that can support them. Educating veterans on resources and benefits that they have earned and are eligible for, and educating partners on what veterans need within that community to thrive. Advocate on behalf of veterans and advocate on behalf of the community to ensure resources exist to best support the veteran population, and then collaborate with everyone to get that job done. So we do look at veterans, family members, and caregivers with that philosophy of one size fits one, and it requires a holistic approach that Deb was touching on. And this all starts with that proactive outreach and engagement with all veterans. So not just the ones that are seeking support.
Yeah, it's about the relationships that we build as providers, to build off of that, to ensure that that people know who they can go to and what they can do when they have things that happen in their lives that are causing them undue stress. Thank you for that, Kaitlin. Appreciate you expanding on that. Deb, can you discuss how community integration supports an upstream approach to veteran suicide within the context of the public health model? You touched on it a little bit. Could you expand a little more?
Sure. So in 2020, CDC developed its strategic plan for suicide prevention, and our vision is no lives lost to suicide. And our mission, or how we strive to reach this vision, is to use data, science, and partnerships to identify and implement effective suicide prevention strategies to foster healthy and resilient communities across the US. And part of this mission is a comprehensive public health approach to suicide prevention with a focus on populations disproportionately impacted by suicide, such as veterans, service members, and their families, and an upstream approach to prevention. And as I mentioned earlier, CDC recognizes that many factors and influences, including health disparities, impact risk for suicide. So to help address these many risks and disparities associated with suicide, CDC developed Preventing Suicide, a technical package of policy, programs, and practices, otherwise just known as our technical package. And the technical package helps communities implement prevention strategies with the best available evidence. And just to give you a little flavor of the technical package, the strategies seek to stop suicide before someone becomes suicidal, as we were talking about in terms of upstream prevention. Also support people at increased risk and seek to keep people safe after a suicide attempt or after the loss of a family or loved one to suicide. And the strategies seek to impact community and societal issues such as economic hardship and healthcare access, as well as relationship issues and individual level challenges such as substance misuse, untreated mental health conditions, trouble with coping and problem solving skills, and the like. And The technical package also focuses on one of the biggest protective factors, which is connectedness. And when we talk about connectedness, we mean helping people to connect not only to each other, but to their community through community engagement activities. For example, community greening initiatives or connections to community supportive services such as job and financial supports and health or social services. So connectedness also refers to connections or linkages between community organizations to make sure that people don't fall through the cracks as they access or transition between services. Suicide prevention is really strengthened by broad community partnerships across sectors such as housing, education, and healthcare. And it really works to expand, these partnerships work to expand the reach of suicide prevention efforts, forming a whole community approach that can save lives. And just a couple other points I wanted to make are that partnerships and community integration is really, as I mentioned, so key. And CDC has been really pleased to be funding veteran serving organizations who play a vital role in the upstream approach. And we've been fortunate to partner with AWP in the past. We look forward to our continued work with AWP. And many of the organizations are engaging in upstream prevention programs through community integration every day. And examples, just a couple of examples of this work, veteran serving organizations include improving programs to address veteran homelessness, of risk factor for suicide, development of resources to simplify referrals to services across organizations, and development of an index or tool which allows resources to be targeted geographically as needed to best support veteran needs. So more about this work can be found at the CDC Foundation website. They have a nice blog post on there, and that website is cdcfoundation.org. And then we also have more about our work in the veteran space on our new CDC suicide prevention website, which is www.cdc.org/suicide. So in summary, community integration really means connecting people to each other and to their communities and working together to foster healthy people, communities, and resilience. And when we do that, we can really save lives.
Yeah, absolutely. Kaitlin, Deb's talking, a lot about the connectedness piece. Can you share with our viewers a little bit about what we've seen with our annual survey, demonstrating that exact point that she's talking about?
Yeah, so I always love getting together with the CDC just because we align so well on these things. So when veterans are engaged with our community integration model, they're assessed holistically to ensure that their life is balanced in 8 areas, talking about the strong relationships, meaningful employment, and then access to even purposeful activities or housing. So if one of those pillars are altered, then the quality of life for that individual is in jeopardy. So what we found with our model and how our veterans are engaged early and often to be connected to housing, education, employment, and benefits, we've also seen that veterans are more engaged in their community and in events, and those that are engaged have an improved quality of life. So we've seen from our annual survey we do each year to ask veterans if they're satisfied with their local support, if they're feeling more connected or empowered. We've seen over the course of 5 years that there's been an increase in those feeling more connected to their community, which is necessary to help with the upstream approach, and also those that feel empowered by their community. So they not only know where to go, they know how to help themselves. So that's just a little bit of the impact that we've seen using our America's Warrior Partnership community integration model.
Yeah, a lot of veterans that I've spoken with, you'll hear they want a continuation of their service once post-service, and the opportunity to connect with other veterans, to connect into volunteer opportunities or enrichment activities such as recreational has been something that we have been hearing over and over again, and very important. Kaitlin, what is the impact that the America Warrior Partnership model is making in improving the quality of life and increasing the protective factors for veterans in diverse communities?
So we touched on this just a little bit, but it is that proactive outreach and engagement. So as Cheree mentioned at the beginning, we've proactively outreach engaged to 56,000 veterans. Those are the ones that know where to go and who to turn to for support before a crisis ever occurs, and really bridging that network of support with partners collaboratively, to Deb's point of making sure that veterans do not fall through the cracks. So the communities where we have implemented our model, we've seen just thriving veteran population altogether.
And Kaitlin and Deb, throughout this conversation, you have mentioned some tools and some tips for best practices. But what I'd like to do now is if we could talk through those, and then we can provide that information for our viewers. If you would please talk through tools, tips, or best practices that you've observed or evaluated for local programs that others can use to implement an upstream approach to suicide prevention.
Sure, I can get us started. So let me just share a few resources. So CDC is currently funding 11 recipients right now to implement and evaluate the comprehensive public health approach. And this approach relies on strong partnerships with robust communication plans, quality data, a knowledge of what other prevention programs are going on in the community, and then selecting prevention strategies to fill gaps and that have the best available evidence, and that address the multiple factors that are associated with suicide, as I mentioned previously. And the entire approach is then implemented and evaluated on an ongoing basis. Local programs can connect with our comprehensive suicide prevention recipients and also to their state suicide prevention coordinators to get involved. And local programs can also work with partners to use CDC's technical package that I mentioned to learn about the 7 strategies for suicide prevention. And if you wouldn't mind my just telling you briefly the 7 strategies here. So they're strengthening economic supports, for example, by improving household financial security and housing, strengthening access and delivery of suicide care, especially in underserved communities or rural communities, creating protective environments is the 3rd strategy. This can happen through safe storage of lethal means of suicide, such as medications and firearms. And then promoting connectedness is the next strategy, which can take place through community activities and projects that I mentioned. The next strategy is teaching coping and problem-solving skills, including building skills for parents, for example, to help work with their families and their children to have healthy family members and children, and then identifying and supporting people at risk through evidence-based treatments and crisis support for people with lived experience. And then the last strategy I'll mention is lessening harms and preventing future risk through such things as safe messaging after a suicide takes place and support of surviving friends and family members. And as one example of how these strategies are being implemented by our recipients, North Carolina, for example, has implemented a first of a series of comprehensive suicide prevention academies. And these academies provide workforce development opportunities for community members and professionals engaging with veterans, such as identifying veterans at risk and providing information or referrals to existing community resources, developing collaborations to promote firearm storage, and learning telehealth practices for suicide screening. And we are working with partners to build out implementation guidance for the technical package to help local communities determine which strategies are best for them.
Right.
In the meantime, we do have some existing resources on our CDC Veto Violence website. And this website provides guidance, tools for community planning, implementation, and evaluation. And it's available if you just Google CDC veto violence. This site also provides success stories and practical support for implementing the whole suite of CDC technical packages, which we have focused on not only suicide prevention, but we have technical packages for preventing child abuse and neglect and intimate partner violence, youth violence, all things that we know are also associated with suicide and have shared risk and protective factors. So those are some of the resources that we have available. And again, all of this really requires community integration through a public health approach. And so when we work together, we really know and believe that we can make a difference and save lives of individuals, families, and communities.
Yeah, absolutely. Kaitlin?
To touch on a little bit of America's Warrior Partnership and what we're doing. So we have the Community Integration Playbook, which is a step-by-step guide for each community to implement best practices, focusing on quality of life, which is the long-term impact of ending veteran suicide. So we have that survey that we talked about a little bit with the 5-year analysis. And one thing that I can tell a community right now is it starts with those relationship building and trusted relationship building. So engage early, often, and continuously. So the more likely veterans are engaged, and for the long term engaged, the more likely they are to have an improved quality of life. And another piece, Deb talked about that collaboration and how important it is. So veterans are usually seeking access to more than 4 resources, even if they're set, even if they have a good job, whether it's getting involved, whether it's support with relationships, whether it's getting access to benefits. You need that collaboration so that you can pick up the phone and say, hey, who's my partner in employment? Who's my partner in healthcare? And building that relationship between each other so that you're strengthening that network of support locally. And then the last thing is veterans being connected to those holistic pieces is important. So focusing on the holistic part of the veteran, knowing that veterans don't have just one issue or one need or one want. They have a diverse amount of those that needs to be addressed to improve their quality of life. And then coming up, we have a symposium. So if you want to learn more about community integration, Cheree Tham will be speaking on 10 years of us evaluating community integration. And then we also have some representatives from the CDC speaking as well on upstream approaches and evaluation. So I hope that you can attend that. And we also have local community service providers talking about how they implement community integration within their community on our workshop, which is October 25th. And then the last thing I'm going to say is the CDC has this evaluation framework that works wonders. So veterans are always adapting, and they're a very ambitious population and have infinite wants and needs. So it's important for all of your programs to stay on top of that.
Exactly. And I hear from both of you a constant theme that has been apparent through all this. This is not a myopic situation. It's not just one circumstance. It's a broad, holistic. Kaitlin used the word holistic. Look at a person and their quality of life and their well-being. And so looking at all those different things about what they're looking for and how they feel they would like to improve their quality of life is important for us to do. In addition to the great conversation we've had with Kaitlin and Deb, I'd also like to remind our viewers of Operation Deep Dive. As you have heard discussed today, we know every veteran community is unique and distinct, depending on the area of the country where they are located. Because of this, the challenges impacting veterans in one state may be vastly different from another. Our goal with Operation Deep Dive is to understand these challenges and, more importantly, address how community leaders can resolve them. First and foremost, if you have lost a veteran who is a loved one to suicide or accidental overdose, drowning, asphyxiation, high-speed single driving car accident, or suicide by law enforcement within the last 24 months, I encourage you to consider participating in an interview with our research team. We want to understand their story and how they were engaged with the community prior to their death. Your insights will give local organizations guidance on how to better direct their efforts, engage their veterans, and enhance their quality of life. If you're not eligible for an interview, there's much more you can do to support Operation Deep Dive. Please consider sharing information about Operation Deep Dive with your personal network. Alerting a close friend or colleague about the study could provide them the opportunity to share their story and help reduce the likelihood of veterans dying by suicide or non-natural causes in the future. In addition to Operation Deep Dive, veterans should also know there's a wide range of programs and services available to help them overcome a challenge. You've heard some of those today with Kaitlin and Deb. If you're facing an urgent crisis, you should always call the Veteran Crisis Hotline by dialing 1-800-273-8255 and pressing 1. You can also send a text message to 838-255. So that's all the time we have for today. But is there anything additional that Deb or Kaitlin, you would like to share that we haven't covered?
Sure, I'll start. I just want to say, reach out to the veterans in your community. It starts with that relationship. You don't know who you're going to touch just by saying hello in the grocery store. And if you want to learn more about community integration, please consider attending our symposium.
Thanks. And I would just want to reiterate that suicide is preventable, and this being Suicide Prevention Month, it's a great time to really reach out to the veterans in your lives and others, and learning the warning signs for suicide and knowing how to respond and get help appropriately. So this is a great time to raise awareness and to take those steps, because we can all play a role in suicide prevention.
Absolutely. Well, thank you all for joining our discussion, and stay tuned to the America's Warrior Partnership Facebook page for information on future Operation Deep Dive discussions and updates, as well as upstream approaches around veteran suicide. Thank you very much.